Funding for the Maddy Report is made possible by grants from the wonderful company harvesting health and happiness around the world, California Emerging Technology Fund, and
Fresno State, where bold begins.
The Maddy Report is also made possible thanks to contributions from Era Energy LLC, BNSF Railway, E&J Gallo Winery, and Harris Ranch and Inn. Thank you. From the State Capitol and the Maddy Institute, this is the Maddy Report with Executive Director of the Maddy Institute, Mark Kepler.
Welcome. So what does telemedicine look like on the front lines? We have a great person to answer that question, Dr. Casey Gray, the Chief of Information Technology at Kaiser Permanente, Fresno. Welcome to the Maddy Report.
Good morning. Thank you for having me. I appreciate being here.
So in California, Kaiser has been really one of the leaders, early adapters of telehealth. What exactly does telemedicine look like at Kaiser, and how prevalent is its use?
Yeah, so telehealth has been in use for many years at Kaiser, actually dating back to the late 90s. We have been using various forms of remote visits, secure emails, telephone visits since then. And what we do now is mainly interact with patients virtually through a form of video visits, telephone visits, or secure messages. And so many of our patients now, instead of having to come to the office and potentially be exposed in this COVID pandemic, can stay home and reach out to us as their primary care providers and specialists from the convenience of their homes. And we're able to provide an incredible amount of support and medicine nowadays that we thought was really never possible in the past. And so between the combination with Kaiser Permanente of using our website, which is the kp.org website, where they can view labs, view their medical history, view their diagnoses, refill prescriptions, and things like that, they can also reach out to me directly as their, for example, their pediatrician.
That's interesting too, because in certain places like the San Joaquin Valley, there's a real lack of doctors. It seems like it's going to open up a lot more opportunities for both general practitioners and also specialists in medicine.
Yeah, absolutely. And when I talk about this remote care, it's not limited just to the primary care providers, but it is absolutely involving our specialists as well. The beauty of how we handle in Kaiser Permanente the video visits in particular is that I can actually pull a specialist into a video visit if I need to for a consultation on the fly. And I can also reach out to a specialist and do a video visit just between he and I or she and I for a consultation that way as well. So we're able to reach a much broader range of patients now who don't have to worry about driving into the medical office, and especially in the Valley where patients do sometimes have quite a drive to get here. This is often offering a convenience factor that we haven't really seen before.
Yeah, so I'm thinking that telemedicine is really improving health outcomes. I'm guessing, for patients in many ways.
Yeah, I believe it is. I think that people have been, understandably afraid during this COVID-19 pandemic and haven't wanted to come to the office. And having the ability to use something like a video visit to reach out to a family from the safety and convenience of their home has really opened a lot of doors for patients. And it's allowed us to stay in touch with patients who need to continue and be in tight contact with their primary care provider. So yeah, especially in a time like this, when patients don't want to come into the office, we allow them the option of seeing us through video, of contacting us by phone, or even by sending us email messages. For example, I have parents will email me about a picture of a rash and ask me, hey, what should I do with this? And in many ways, I'm doing a full visit by evaluating that rash on the picture they sent me. I'm discussing the diagnosis and the treatment plan with the parents, and they do it all from home without having to come into the office. It's pretty incredible.
Yeah, and another thing I'm wondering about though is what about the business is a question I was just thinking of, the business side of this. Can hospitals still make money with telemedicine? Because are they getting their fees paid?
Yeah, so it's an interesting question, and I think it applies very differently to different people. In a group like mine within Kaiser Permanente, where we are both the insurance provider and the medical providers, it works incredibly well because we're able to still continue to prevent disease progression. And we don't have a need for the continual copay. So for me, taking care of my patients, whether I take care of you virtually or in the office, doesn't make a bit of difference to me. I can do it whichever way is most convenient for my families.
Yeah. So I want to ask you this: what about there are going to be perceived advantages and disadvantages of telemedicine? What is Kaiser doing to accentuate those perceived advantages, and what are they doing to address those perceived disadvantages of telemedicine?
Sure. So I think to address the advantages, I think doing those video visits really speak for themselves. The more that we do, the more positive feedback we're getting. In fact, we went from a place prior to April of this year of doing roughly 15-20% of our visits via telehealth. And then all of a sudden, COVID-19 hit. And in April, we did 80% of our visits via telehealth. And so what we've done now is not required, but offered them these telehealth visits as a convenience factor. And I think patients really appreciate that. We're not making them do video visits. We're not making them call us. We're allowing them to do that in whichever way is more convenient for them. The disadvantages, you can see on both sides, actually. I think a lot of physicians were skeptical about video visits. Can we actually make an accurate diagnosis? Can we actually treat patients when we're not physically laying hands on them?
And the answer is it good?
The answer is it's amazing, actually. I think without this pandemic, without forcing us, I don't think we would have realized what we're capable of over video. It's really forced the hand of providers in a very good way.
It's a brave new world. I want to thank Dr. Casey Gray with Kaiser Permanente in Fresno for joining us. Up next, we're going to have a conversation about telehealth in a little more detail. Is it good for everyone? That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Kepler with the Maddy Institute. Telemedicine sounds great in theory, but how does it work for seniors? Our guest is Laurence Du Sault with the San Jose Mercury News and CalMatters, who's written extensively about the impact of telemedicine on seniors' healthcare. Welcome to the Maddy Report.
Thank you. Thanks for having me.
So what are the key impediments to seniors fully utilizing telemedicine? I assume they've got some unique issues.
They do. I think the first one and the most evident is access to home broadband. According to the Census Bureau, 73% of seniors who are low income don't have internet. And so without internet, you cannot get access to healthcare on the web. That's for sure. So that's the first one. Loneliness is also, something that's prominent for elders. It's something that is that impedes their mental health, first of all, which is a big part of health for seniors. I remember this one doctor I spoke with, who's a UCSF professor of medicine, and she was telling me how every single one of her elderly client had to get help from a family member to set up their telemedicine. And so what that tells you is that there's probably a big proportion of our senior population who lives alone. That's 1 out of 4 senior lives alone in the US, who doesn't have that help to get broadband, download an app, set up your Facebook account.
One thing I was thinking also is think about the kind of the medical issues that seniors have, dementia, hearing, vision. I mean, that also plays in this, I would assume, as well.
It does. A lot of it has to do with, manipulation, how to hear. A lot of these apps are not, won't be helpful for someone who can't hear or has, a blurred vision. Yeah, that's definitely something people have been struggling with.
Yeah, I mean, so is there any concern that this is increased reliance on telemedicine? This thing is not going away. Is it going to actually reduce seniors' access to healthcare?
It already is. And of course, we need to be clear on that point. If someone has an urgent needs to go to the emergency room, that type of care is still, available for folks. But it's the little things, and as you grow older, you have certain needs that we don't as, younger people. So for example, I spoke to a man who has big back problems. And it's been very painful for him. And he has not been able to get an assessment. He's low-income elder, does not have broadband, does not have a device. And so it has been quite hard for those folks, yeah.
Yeah, I'm assuming that's not a unique story. I'm thinking that probably is replicated with a lot of seniors having issues. So let me ask you this. What do you think needs to be done to ensure that seniors benefit from this growing trend toward telemedicine?
Well, I think the first step would be to have a standardized approach across the state. The Department of Aging has been talking about making telehealth a part of Medicare and Medicaid. So I think that would be an ideal solution. In the meantime, providers, they tell us to check on the elders that we know. Just call, show up, knock, and then get back a few feet, ask if they need help. There's really interesting work being done by nonprofits, the Community Tech Network in San Francisco, Oakland at Risk in Oakland, are doing work right now that is helping.
Well, I want to thank Laurence Du Sault with the San Jose Mercury News and CalMatters for joining us. Thanks very much. Well,
Of course.
what are the public policy prescriptions that might improve telehealth for seniors and all Californians? That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Kepler with the Maddy Institute. We're now going to shift our attention to focus on the public policy prescriptions of what might be done to improve the delivery of healthcare through telehealth. And our guest is State Assemblymember Joaquin Arambula. He's had some prior experience as a physician working in Selma before he joined the State Assembly. And so he has a pretty unique perspective on this issue from both a public policy side and from a health side. So welcome back to the Maddy Report.
Thanks for having me again.
So I want to get your take on how you would assess access to telehealth in California generally and the San Joaquin Valley in particular.
Well, I would, if I can, I want to go back to a quote that JFK said. He was quoted as talking about the Chinese word for crisis was two characters. One was danger and the other was opportunity. I would say that we're in a huge crisis right now as we are facing the pandemic of the century. And there is danger all around from not getting preventative care that is so important for our community. But there's also an opportunity for us to look towards new modalities and to look towards the future and making sure that we are embracing it. And while I know there are many challenges in the Central Valley in terms of access to broadband, in terms of access to doctors, I see a real opportunity as well during this crisis for us to make sure that we are looking towards telehealth and making sure that we are doing everything we can to embrace it.
Yeah, I think that, you make a really interesting point there because, for years we've been talking about, certain parts of the state, like the San Joaquin Valley, that really have experienced a real lack of medical care professionals. And I'm just wondering, you think telehealth is going to change that? And, one of the issues is specialized medical services, another real problem in places like the Valley. Is telehealth the answer or an answer?
Yeah, I really look towards this pandemic as providing a magnifying glass on many of the disparities that occurred prior to the pandemic coming. We had these issues with shortage of providers in the Central Valley for decades. Now, I am encouraged that this year in our state budget, we had $15 million that is being allocated towards a medical school in the Valley, in Fresno, that will be ongoing, as that will help us to address some of these disparities. But do acknowledge that we need to work on things like I mentioned earlier, broadband access, so that we can take full advantage of these new modalities like telehealth. But if I could, as you're talking about specialty care, just say what associations are sharing with me, which is that behavioral health visits have increased significantly.
I was also wondering about, these community health centers. How does telehealth fit in with community health centers, which a lot of these rural areas really rely on?
Well, that's one of the policy areas I really hope we can fix. There were flexibilities given during this pandemic to encourage payment parity between in-person visits and telehealth visits. That is something that needs to continue into the future so that we can encourage this new modality. Our community needs these behavioral health visits. They need opportunities to see providers who might not be in their backyard. And I think when you have payment parity, you can encourage this new modality and make sure we're connecting people to services and to providers where they're at. So we can do culturally and linguistically competent service so that we're increasing access in a way that is being received by our community.
Yeah, it's really interesting that sometimes these tipping points in history, can really result, like you said early on, right? We're in a crisis, but there's it's danger, but there's also a tremendous opportunity. So if you look at this from a positive standpoint, I mean, perhaps telehealth could really be of a benefit, particularly in those areas that are underserved. Because I know you've done a lot of work trying to bring a medical school to the Valley to increase the number of physicians, et cetera. And so this could potentially be the answer. But obviously, we're going to need some public policy prescriptions. So we're going to need some legislation to move this forward on lots of different issues. So I want to kind of ask you about that. What do you think the policies that the state ought to be enacting to kind of improve the delivery of telehealth in regions like the San Joaquin Valley?
I'd start by encouraging us to make sure we're leaning into the value that healthcare is a human right. When we are in that place, we can make sure we're providing healthcare for all. During this pandemic, more than ever, we see that the health of each of us depends on the health of all of us. And so I think it's incumbent on us to make sure we can provide care to all of our community so we can make sure that we stay safe. Preventative care and encouraging people to seek providers and looking towards these new modalities. Training more providers who are in our community by having a medical school here and looking towards payment parity within telehealth. There are 3 prescriptions that I would look towards in policy areas that I think could help us.
One of the things also too is just connectivity, right? I mean, making broadband accessible to those rural areas. This is all tied together. It's concentric circles, right? Do you think the state needs to step in on that area and provide more funding for, expansion of broadband?
Well, I have 3 kids who are doing distance learning now. If you don't have internet access, it's hard for me to feel like you have access to educational opportunities. And if that also is then equated into medical visits, I think that we have to really start thinking of the internet as a utility, as something that's actually required for us to live, and would just encourage.
So what's your prognosis, doctor? Are you feeling fairly positive about this development, or what do you think?
I think it's an incredible opportunity for us. I really do, for us to look towards the future and for us to figure out how to make sure people can get services where they're at. I just think back to Selma. Sometimes when it's foggy, people wouldn't come to see me. Sometimes when they didn't have gas, they wouldn't come to see me. Well, now if we can connect via a phone, just like we're talking now, I think there's a real opportunity for us to see a way to increase access. And I think that's something that we should make sure that we encourage in our communities.
Oh, that's fantastic. Well, I want to thank our guest, Dr. Joaquin Arambula, State Assembly member from Fresno. Up next, we're going to talk with a board member from the California Emerging Technologies Fund. That's one of the state's leading efforts to fund broadband expansion throughout the state and really address the digital divide. That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Kepler with the Maddy Institute. We've been talking about the digital divide, and for a lot of people, what's at stake is simply the inconvenience of slow internet service. But for those dealing with telemedicine, in the age of telemedicine, it really could be a matter of life and death. And our guest is someone who's trying to close that digital divide. Our guest is Barb Yellowlees, the CEO of HealthLink Now and a board member of the California Emerging Technologies Fund. Welcome to the Maddy Report.
I'm very happy to be here. Thank you.
So I want to ask you about some recent surveys that we've seen that indicate that there's a real disparity on the impact of coronavirus on various Californians, particularly various demographic groups. And surveys are also showing that there's a direct relationship between household income and the threat posed by health issues like the coronavirus. So how is the California Emergency Technology Fund really dealing with that digital divide?
CETF has been focused on eliminating the digital divide for over 13 years. We know the digital divide is just another manifestation of the economic divide, and therefore low-income residents are more likely to lack broadband. We've always recognized that as a reality and been focused on getting broadband out to low-income households. Our goals have always been to drive expansion of broadband across our state for underserved communities, but to also encourage broadband adoption into homes. Our goal is to make sure there's access and adoption of broadband for all Californians, not just some, all Californians.
Well, let me ask you, Barb, how are you going to go about doing that? What kind of policies do you want to see at the federal, state, and local level to make that happen?
Well, there are several things that have to happen, but one thing I wanted to touch on was the impact of COVID-19. It really has come to us that we were sort of ahead of the game in a big way. We've always known that we wanted to get broadband out there, but COVID-19 has made access to broadband even more necessary. This pandemic requires us to stay at home, for many to work at home. Our kids have to do online learning. That means we have to have broadband. Some people just assume everybody has broadband and has computers. That's how we're supposed to live and work. But when you're talking about communities across our state who are low income, that's just not a possibility without help. There are some people that can access their healthcare providers now through telemedicine. A lot of the big health plans switched almost automatically. And so these doctors are available to see a lot of people. But for people in low income and some with racial and ethnic groups who are more likely to lack broadband, let alone computers at home, they can't access these resources. They can't connect to school or to the health services that they need. Some of these low-income people, they lost their jobs, restaurants, small businesses. They're struggling to pay the rent, to buy food. And we're telling them now, go home and work off computers, have your kids connected. CETF believes that broadband is a basic right and should be available to everyone in our state.
Well, what would you tell like leaders in poor communities? What can they do, like in places like the Valley? What they can do to kind of help gain access to healthcare through things like telemedicine? Are there things that local officials can do?
There's a lot. Community leaders actually need to be the digital champions. They need to fight for their communities. They need to become educated themselves and to speak out to local, state, and federal elected legislators. They need to promote funding for broadband, and what we're really pushing for is broadband and for funding telemedicine. This pandemic has made it clear that it's actually essential for our survival. CETF is grateful to Fresno State and the other San Joaquin Valley leaders. They have really been at the forefront of supporting telemedicine and broadband for many years. They are currently supporting a bill that we're sponsoring, AB 570, that is seeking funding for telemedicine and distance learning. We're also working in the San Joaquin Valley period is represented by some very strong voices in our state legislature. I don't think that's news to you. Sonny McPeak, our CEO, has been working directly with Dr. Joaquin Arambula to help expand telemedicine and broadband in California.
Well, it's, a lot of stuff going on here, and obviously I think it's going to be accelerating in the future. I want to thank our guest, Barb Yellowlees with the California Emergency Technology Fund. Thank you so much for being with us. I want to thank our other guests, Dr. Casey Gray with Kaiser Permanente, Laurence Du Sault with the San Jose Mercury News and CalMatters, and State Assemblymember Joaquin Arambula. If you want to stay current with state and local politics, you can log on to our website at maddyinstitute.org. This is Mark Kepler for the Maddy Report. Thanks for joining us. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect those of the California Channel or the Maddy Institute.
If you'd like to share your thoughts about the points and opinions expressed on the Maddy Report, visit our website at maddyinstitute.org.